pressure back and forth, walking up spinalis, come back down, walk up longissimus, come back down, walk up iliocostalis, going out a little laterally. Feeling ribs, feeling where tone is in the back, feeling the general shape of the back. After I do that, I go for my most superficial layer deep. So I'm gonna start with trap, pressure into the SPs with my fingertips. Could also use broad thumbs here, nudging my way down the spine, changing my angle to follow those lower trap fibers as I get towards T12. Then I stop and come back for a second, go to T7, and I go straight across, because now a little deeper than trap would be my lat fibers that are going in through those SPs all the way down into the thoracolumbar fascia. You could technically go all the way to the tailbone almost through that fascia, and then with my thumbs pressing down and walking them back and forth into the superior aspect of the ilium near the spine there, working my way lateral. Then I go back and finish with trap, so I'm going into those SPs, start nudging into the nuchal ligament SPs as I go up, and then find that superior nuchal line and nudge along that too. Switching hands so I can duck bill grip the trap, upper trap fibers, squeezing them down. Then I get to the distal 1/3 of the clavicle. I'm pushing down with my thumb like so into the back of the clavicle, and then I'm working my way along the clavicle, the acromion, and then the spine of the scapula, like so. After I do that, at that point I usually switch sides and just do the other side. So, same thing, nudging my way down the SPs of trap to T12, changing my angle. Maybe I'll go up and finish trap first. I could do that with the flow as well. So go up to the superior nuchal line, squeeze those upper trap fibers, work the back of the clavicle. So posterior aspect, we're pushing in from P to A, and then along the spine of the scapula. I might even press and do a little levator work. So as I went along that spine of the scapula, then I shift up a little bit, so now I'm on the superior angle of the scapula, press into that for levator, and then switch and go up the TPs now, C4 to C1 of levator scapula. But in the other side, this is the point where now I went back to T7, and I went down with horizontal pressure into those SPs, doing a pure rotation kind of motion palpation through them, into the sacrum, and along for lat. One thing I forgot to do, maybe it's just that I'm talking so much, is don't forget to squeeze the belly of lat with your duckbill contact. And then I like to use both hands when I do it, so I can really get a big grip of it. You can use one hand too. Be mindful of if you're grabbing a bunch of like Terry's minor and major and like infraspinatus and rotator cuff stuff, the lat fiber is, the lat tendon becomes small up here. And so the most lateral kind of tendon you're feeling, that's all lat. And you can even squeeze and start following it this way and see what fiber of it was the most taut feeling to you, so you can go after that insertion point of it, or origin point in this case. On this side, just to demonstrate that, duckbill grip. My thumbs are on top, fingers are on bottom, but I'm just squeezing. This is me grabbing a bunch of the shoulder, so I'm getting like Terry's minor, major, and all that. This is me just grabbing lat. So be mindful of grabbing a big chunk of their shoulder versus just grabbing that lat fiber. I'm getting a little, it's definitely tight right there. And you'll find a lot of patients' lat is super tight, because if they have back pain, lat inserts on their back, that's probably contributing to it. After I've hit all that superficial area, now I'm going to those erectors. If I wanted to go after QL, I'm going to do that after this, just because it's even deeper. So I like to do that move where I pin the upper part of the ilium near the sacrum, and then with my hypothenar of my caudad hand, then with my cephalad hand, with my caudal hand, that is what I'm going to now press up and walk up the erectors while kind of pin and stretching that erector. I'm always keeping general upward pressure through, because that's how it's inserting. So I'm walking my way up, and I'm not lifting my hand and putting it back down. I'm kind of nudging and then sliding up, trying to keep as much contact as I can with the patient. So I'm technically, when I'm doing this, I'm never losing contact with their shirt, even though I'm lifting my pressure up. And then I just go through those erectors again, feeling for the ribs. Then I might just switch sides without walking around the table, nudge my way up spinalis, nudge my way up longissimus, and then nudge my way up iliocostalis. iliocostalis. At this point, I like to do that smush move where I just kind of smush everything to see what's going on deep in there. So I do this kind of double soft elbow contact where I'm not using sharp pointy elbows. And I just generally put my weight into the patient. I don't put everything I got into them unless I feel like they're doing well and I can start really leaning my body weight in. But right now I feel changes. I feel kind of little twitches happening. I feel fibers loosening up. So I'm just gonna hold this gentle pressure, kind of just smush into the back. Patient's taking nice deep breaths. They're feeling what it feels like. They're releasing tension in their ribs. Move up a little bit. Find a different point I feel. And I just hold that, let the patient breathe. Give them a chance to let them exhale, let things twitch a little bit, and move up again. And I don't know if you can see it or if it shows up on the videos, but there's like kind of this happening, you know, with the patient's spine or back. It's like kind of shifting. And as it shifts and that tone starts to release, I'm kind of feeling it, kind of like that. Nice thing about doing this smush move too is when you feel things releasing, you can try to tune in and see what the fiber direction was of the muscle releasing. So you can go, oh, I kind of felt something over here. Now I'm going to tune into this rib. At this point, I have a couple of moves I can do. One is I could go after QL. But I usually save that for a second. First, what I like to do, since I just did erector work, is now here I like to sit at the head of the table, and this is where I start really tuning into ribs. So I noticed different points when I was doing those smushes and doing those different contact points, and even just walking my fingers at the beginning. I noticed different ribs that were prominent, or it feels like insertion points along those ribs, whether it's an erector spinate or an intercostal, deep to all of that. And I just start to find different points that I want to work on. So right here I got a rib. I'm kind of lifting up and into it and just holding my finger almost like I'm playing a piano, but trying to keep my fingers flat and gentle as possible while still having decent pinpoint force. Notice I'm not resting my hand on the patient, dividing their brain's attention. I'm also just feeling in and just noticing, all right, like right there, I feel a really gnarly little rib point. The rib, I'm in between the two ribs, kind of lifting up into the superior rib, but I'm also pressing into the intercostal fiber. And I just start kind of scanning the body with fingertips like this, noticing like different points. So now I've got another fiber, probably iliocostalis coming up. I'm gonna nudge into this one right here next. And I just take a minute to check and find any different points along the ribs that are standing out at me until it starts to all start feeling more soft and has that nice tone to it as well. Not related to anything I do, but a massage therapist did this once to me and I thought it felt really good. So if you ever want to do this move, you could do this too. I don't know why it feels so good because it's the opposite of what I was just doing and talking about where I'm pushing into the SPs, but you just take your thumbs and you just pull horizontally outward from the SP and you just kind of work your way down the whole spine. I don't know why. I think it feels really good and maybe your patient does too, but that's just a fun little move I wanted to throw in there.